Okay, so thanks very much for joining. I'm very excited to introduce Connie and our community health and wellbeing workers, Jasmine, Blackmoore, Sophie, Kuprashvili. Thank you very much for joining us. I know Connie's got some slides that she's planning on presenting. If you've not been to one of these before, this is the Quality Improvement Network, and we very much try to make this a place where anyone can bring any issues they have about research impact or quality improvement or knowledge mobilization. So what we usually ask speakers to do is present for a short amount of time, usually about 15 to 20 minutes, and then we have lots of time for discussion and questions and places for you to bring the things that you're currently facing. So very much looking forward to hearing from Connie, Sophie and Jasmine. I'm going to hand it over to Connie now.
Thank you. I think we've got slightly more than 15 minutes, but we're hoping to leave about 20 minutes for questions at the end. Can everybody see my slide?
Yeah.
Yeah. Okay. Right. So without further ado, today I wanted to talk about a fantastic knowledge mobilization project, which is collaborative learning with the community health and wellbeing workers from the UK and Brazil. And so for those who don't know about the community health workers, I just wanted to give a really, really quick update. And we've got Matt here today, so I can just say the four CHUIs or community health and wellbeing workers that you see here in Brazil, they're called community health workers, were Matt's community health workers when he worked in Brazil all those years ago in the late 90s. So they started with 7 teams of community health workers in Brazil. They've now got 400,000 community health workers all over the country, and they've led to remarkable improvements in population health directly linked to community health workers. So there's Bernardo on the right-hand side, who came to visit us for reciprocal learning last year. And if you're interested in finding out what the community health workers shifted, there's a website on the NAPC, on the National Association of Primary Care, which is something I'm going to share, where you can look up the evidence on this. Matt here boiled it down to about 4 principles that have to be in place, conveniently called the CHUI principles. And they all 4 have to be there for this to be the model according to the Brazilian family health strategy. And comprehensive stands for comprehensive at the household level, for baby, grandmother, and anybody in between, and any issue of importance to the household. Hyper local, so people from that community, for that community, trained and paid. Universal, so everybody of their 120 households that they're allocated to visit regularly get seen, but some of those who are in need get seen more often, so that's the proportionate universality. And then integrated in the primary care team, so they're part of the primary care team, but also integrated in the community sector, municipality, and that makes them really effective. And here you can see 4 of our first community health workers in the UK. We started off with those 4, and 2 of them are still community health workers in Westminster. Comfort's now retired, and Asma's moved countries, but otherwise they would still be with us. And you can see the map of Churchill Gardens, and every coded building represents 1 community health worker, so you can get a real sense of the territorial geographical nature of this intervention. So they're more community infrastructure. Lots of training. So here you can see they're trained in justice and listening. Professor Poulter teaching our CHUIs how to take blood pressure, the dementia awareness workshop, breastfeeding support with the Human Milk Foundation. And this is just a smorgasbord of teaching, but there's ongoing learning and reflection. And the CHUIs have, of course, a really important community development function as well. So they hold coffee mornings twice a week, actually, at the moment. So lunch and learn and communities. And they're often themed and have guest speakers like the Green Doctors or GPs. We've done dementia workshop, we've done public health campaigns like Measurement May, etc. So where's this up now in the country? So it's grown from 4 community health workers in 2021 and 500 households to about 28 sites now. 195 community health workers around the country, 6 teams in Cornwall alone, and we've got Jasmine here today from Cornwall, 2 teams in Westminster, and we've got Sophie who's going to present with me, and Jasmine. And the NAPC now has a sort of two in a box offer where you and you can find out more about that. And we've got lots of evaluations. So we've got a randomized controlled trial that Matt's leading in Westminster. We've got our Hessa and McCall, who's our PhD students, looking into the fidelity and adaptation from the Brazilian model, and lots of other evaluations. And I just wanted to share this hot off the press. So this is from Cornwall, just now looking at the impact of investing their 1.9 million health inequalities money into the TUI program, and they found 2.33 pounds generated for each pound invested, so a total social return on investment of 4,600,000 and 40 new full-time jobs created. And this is, of course, a really fantastic thing about the community health workers, that they are sort of like an entrance level in a way, that you can create lots of new jobs with this. We have lots of community health workers who hadn't worked before or had been out of work for a while. But really, turning to what I've come to talk to you about today, which is planetary health and bringing the community health workers together for a convening in Rio with Brazil and UK community health workers. And why did we do this? So we know from the Lancet Commission on Planetary Health that the climate crisis is the biggest health risk facing us today, and there are 6 actions we need to do right now to mitigate climate change, and these are rewilding a third of the land, rewilding a third of the oceans, adopting a plant-based diet, stopping fossil fuels, focusing on a well-being economy, and stabilizing the human population. And you'll look at that and go like, well, not much we can do about that. But actually, if you look at it, if you break that down to what it actually means, the community health workers do a lot of that already. So promoting kitchen gardens, advocating for clean water, promoting healthy foods and diets, advocating for solar panels on schools, for example, making community rights to health and well-being visible, and oh, wait, I don't know what happened with my. Has it just gone a little bit nuts now? Sorry.
It's just gone out of presenter mode, I think, Connie.
Sorry.
For some reason.
It's gone to sleep. The new laptop. Sorry. So I'm going to hand over to Sophie now and talk a little bit about the workshop, who was there, and Sophie, tell me to the slide.
Hi everyone, I'm Sophie. I manage the team in the south of Westminster, and I was one of the lucky people who got to go to Brazil to kind of work a little bit more about how we support with planetary health. And the slides have gone again, Connie.
Sorry.
No worries. I think you're just one slide behind and not in the presenter mode at the moment.
Perils of using a new laptop.
But yeah, so from London, there was me from the south of Westminster, and from north of Westminster, we had Emma, who was the project manager, and Ade, one of the community health and well-being workers. Additionally, we had some people from the Cornwall team. That was 1 GP lead, Alison, 3 Chuis, Benningham, Jasmine, and Joy. Jasmine joining us today. We also had Marcus, who was representing the NAPC. We had Dr. Simon Olfer, who is an MP and also a GP in UK, and we had some colleagues from Imperial College team who were facilitating these workshops and helping us make all of this possible. And we had Alex from the Institute of Development Studies. And that was just the UK side. From the Brazilian side, we had the TUI team joining us from the city or region called Deca de Caxias. And I won't list everyone, but you can read all of their names here. We also had some TUIs joining from Rio, and Bernardo was one of them who also did a study in UK. So there was already some of that reciprocal learning going on beforehand. And we had also 2 TUIs from the Amazon region, which was the most fascinating part because we got to hear how they're able to work in their own kind of unique geographical location where a lot of their work depends on kind of the levels of the rivers in the villages that they're visiting, and kind of challenges that we don't encounter as much as in London. And we also had some people from Fiocruz who were supporting the workshop as well. And if we can go to the next slide, I'm going to tell you a little bit more about the most exciting day of the trip, which was when us, the UK community health and wellbeing workers, got to go to Dekadekashias and visit the homes of the local residents who are being supported by community health and wellbeing workers. And it was really interesting to see, first of all, how valued our collaboration is, not just for us, for them as well. We saw that they have a whole board with all of the gifts we had gotten them, all of the pictures we have taken from previous visits, and kind of we can see that the work that we did there it wasn't left kind of where it was, but it was something that is still being talked about and still being kind of taken quite seriously and quite lovingly. And we got to visit some families with the community health community health and wellbeing workers. The first one was more in kind of the village center. So the family that we visited were talking about how the Jews who were supporting them had been there when the daughter was born, and now the daughter was old enough to have a baby of her own, and how this kind of project allows them to be a part of the family in more longitudinal way that we might be used to. And how when we asked them, how often do you see your community health and wellbeing workers, the question back to us was more so, oh, when are they not here? They're just kind of part of our lives. One of the community health and wellbeing worker, interestingly, was saying that he lives on the top of the hill. So every time he's coming down to the village center, he's able to check in on all of his residents and touch base with them. It was also really interesting to observe that in an area that is not particularly wealthy, and there's kind of a lot of social struggles, especially people talked about issues with transportation, with sanitation, with water. People took a lot of pride in where they lived, and they had no complaints when it came to the healthcare system, which was very interesting to observe. Even the trees themselves talked about the fact that if they need something, they themselves have a tree to rely on. And it created kind of this really beautiful loop of people being able to support each other within the same community, being able to access vaccinations, GP appointments, any specialist help that they might need. Some of our team members were also visiting people who lived in an incredibly rural area that they weren't even registered with any healthcare services. They didn't know what was available to them. And they were the only link kind of with the outside world, because some of these people had like mobility issues. So coming down and back up to from and to their house was a bit difficult. We also were able to see that a lot of things that we have in common. A lot of people struggle with housing, just like we do here in UK. A lot of people struggle with having access to kind of local services outside of the healthcare, and having access to clean air that they want to breathe and things like that. And after the visits, I wanted to highlight that we got the tour of the GP practice where they work and how well integrated they are, that every day starts there, and then they go out into the community, for example. And all of the doctors and nurses are able to accompany people to their homes and be able to deliver some of the services right at their doorstep. And also, we got to see the health secretary and tell them a little bit about the work that we were doing there. And they also told us a little bit of the work that they have been doing in the area, trying to make it better and more accessible for people. I think that's everything from me, but Jazz, if you wanted to reflect a little bit about your experiences of going on these home visits, feel free to jump in.
Yeah, I think you've covered most bits. Me and Sophie actually went out on our visit together because we were split up into pairs. So we had that experience together. But I think I just wanted to highlight the ease of access that the people had to the health centre, had to the Chewies, and had to their doctors, which I think is something we've lost in some areas in the UK. And it was just really inspiring to see how integrated they are 30 years on, and to bring that energy back here. Yeah, it's been incredible.
Oh, thank you both. Fantastic. Yeah. So this is an ongoing collaboration. It wasn't just a one-off workshop. We forging those relationships, and we're hoping to to deepen those relationships in the future. But why did we come together for this week? Like I said, climate change is the biggest health threat of our time, but most curricula haven't caught up on that. And we realised that the community health workers in Brazil and the UK are already doing planetary health work every day. It's just not named as such. And there are lots of gaps also in the WH Global Community Health Worker Curriculum Guide, which just launched. And so our response was to come together, and we said we're going to make this a genuine co-creation. So I had to sit on my hands and not prepare something for people to consult on, but kind of really went there empty-handed and open-hearted and
exchange to Brazil.
Oh.
A group of people. Connie talking about a trip that they went to Brazil.
Oh, okay. And so I'm going to hand over to Sophie to talk a little bit about to Jasmine about what community health workers discovered that they're already doing in this space on planetary health, and both the UK and the Brazilian. So Jasmine, over to you.
Thank you. So in the UK, what the Chewies already do, looking at planetary health work, something that was talked about in the London team was Dr. Bike, looking at green doctors as well, having that. Those people coming into the centre. What was really interesting as well, that they've had access to, you were just telling us, Sophie, the Chelsea Garden Show, bringing in some plants for people to have in their homes. Something else you were telling me about while we were out there was being able to give people plants and seeds that they can put, even if they're in small apartments, on their windowsills, which was incredible to see, even in the city, to have access to that. Down in Cornwall, I think we are very lucky to have access to nature. Although not everyone gets access, even if you're close to the beaches, a lot of families in poverty don't always get to go there. But we do have access to sea swimming. At the moment, I'm part of a project called Well Fed, which is looking at people in our community, and especially our residents who are pre-diabetic or type 2 diabetic, getting them up to Loveland, which is a community growing patch, and getting them to learn how to cook vegetables they might not have come across before. And this is food that's being grown in resilience in Cornwall, and that's things that will last with good crops and that are resilient. So getting them to learn how to cook, and then doing their bloods at the beginning and at the end of 12 weeks to see how that's impacted them. Looking at circular economy, so upcycling clothes, repairing, stitch not ditch classes, warmth and energy. So something you were talking about in London was winter and summer packs, being able to go out and give people ice packs if it's warm, and giving them that space. Also emergency response. So in Cornwall, we recently had Storm Goretti. Many people were left without power for up to 4 days. A lot of trees were down, which blocked the roads. Something that we did here at the centre that I work at was open it up. If people needed access to water, if people needed access to electricity, luckily we were in an area that still had that. So getting people in and being able to help them in that way. And then Connie, if you want to go on to the Brazilian side. And then in what Brazilian Chewies already do. So in Brazil, it's more mitigation for climate, housing and sanitation, checking for foundations, ventilation, looking at waste in the streets, water safety. This was something they were telling us about, mapping out wells, keeping water clean where systems fail, ancestral food knowledge, so teaching garden kitchens, safe food handling, food security from the roots up, vector control. The team from Manaus were telling us that they will go around to their residents, and if they see large open bodies of water, say in pots, they will make sure that they clear that and give them that education around dengue and mosquito breeding. Family and community health, weekly family planning, diversity community advocacy, and then disaster on the ground, flooding and drought is present in the Amazon, so getting that training around disaster climate framing.
Great. Yeah. Thank you, Jasmine. There was so much, wasn't there? We haven't even started to touch it. We had so many case studies of things that we're doing, and every time we talked about something, we're like, oh yeah, we're doing this as well, and this. But you touched on this already. Initially, there was this was what came out, sort of some themes, mitigation versus adaptation. It originally kind of gravitated to mitigation in the UK Chewies and adaptation in the Brazilian Chewies, and that's of course reflecting the reality that low and middle income countries feel the brunt of climate change already, while high income countries are kind of responsible for a lot of it and a little bit shielded from it. Although what emerged later was that we learned that Europe is the fastest heating continent, and we are definitely already feeling the fallout of climate change. So heat deaths, excess heat deaths in metropolitan cities. And we've heard about the the storm in Cornwall. So actually what emerged was that we both do mitigation and adaptation already to some extent, and that it is also sorry, just stopping my laptop from restarting. So that we that it's a matter of social justice, that the community health workers look after communities who contributed the least to climate change and are the most affected by it in both countries. And the other theme that came out quite strongly was that it had to be climate health by stealth. All agreed that you can't, so communities most affected by climate change often are most alienated by climate language. So don't say, let's talk about climate change, and associated with that is kind of like buying bamboo toothbrushes and things like that. But let's talk about clean air, safe water, green space, good food, physical activity, and a good life, because the action is the same. And make this a rights-based approach. This is sort of something that the indigenous trees came up with, the Pachamama, or rights of Mother Earth, leading with that. There are also the rights of our communities to good housing, to clean air, to water, nourishing soil and food. And when we focus on that, we can do climate adaptation and mitigation without mentioning climate health. Not that it's a dirty word, but it kind of takes it from a sort of intellectual debate to something that's really relevant to people. And what also was really interesting was one of the Cornwall contingency saying that what emerged during the Cornwall storms was that nobody was coming over the hill, so waiting for people to arrive with help wasn't really helpful, because actually nobody really mobilized that quickly. So the Chewies realizing that they were the first mile in the planetary health movement, and that they were able to get to people because they knew them and they could help, and that all the power is actually already in the community. This leads me on to how we wanted to learn, which is a really important part. And I'm going to bring in Matt to say this word that I can't say, which is basically critical consciousness. Matt.
Drum roll. Conscientização.
One day I'm going to say it. It's a beautiful word, and it. Thank you, Matt. And it's basically translated as critical consciousness. And what it means is that the idea that communities already hold the knowledge needed to transform their reality. Like I just said, the knowledge is already there. Education is not pouring knowledge into an empty vessel, but so we don't want that didactic model where people sit in a classroom and get talked at, but what they wanted was praxis. So reflection and action together, not theory, then practice, but both together. So the Cornwall Chewies talking about their cases, learning from the Brazilian Chewies, both of them talking about their knowledge, and all of them learning together something new, and dialogue as the method of making that happen. And Jasmine, I don't know, can I put you on the spot to come in here?
Yeah.
Like, how did that feel, doing that in practice?
I think it was really powerful to have that co-creation process together. I really liked, on the first day we were all working together, we started with context from our areas, stories around the community, and like really shaping that idea of where we're from. I think it was a very accessible way to work together. I thought, it was pretty radical. I've never worked like that before, and to be able to talk about, what's important to us, salaries, what we need to do the job well, just felt like such an amazing thing to be a part of. I think the range of perspective as well that was brought together by all the different Chewies, most come from marginalized backgrounds in that area. And I think it just brought like a real richness to the discussion to be able to talk with everyone. And I just think centering community is so important. And it was just inspiring to be a part of that and to share that knowledge. And often, it can come from academic knowledge, which is important, but it's also important to have those voices from the community as well.
Amazing. Sophie, do you want to add to that?
I couldn't agree more about the fact that I have also not worked in a way that the way that we were working there. It felt like everything was being led by us and by the Brazilian Chewies, and it felt more like we were learning from each other rather and creating something new from it altogether, rather than someone telling us what we need to know. And it felt like we were being entrusted a bit more to know what's good for our communities and how we can work with planetary health around this, rather than it never felt like a lecture. It never felt like something that was being imposed on us. It more felt like we were creating something together, and it was very exciting to be a part of that creation process.
Amazing. And it felt like that to me too. It was very new. I just wanted to quickly talk about the 4 layers that emerged during this workshop. So it was felt that this had to be a living curriculum. It couldn't just be a sort of like finite piece, a document that sits somewhere. Like I said, the critical consciousness is sort of the defining piece of it. So we learn together. It's emerging. It's constantly evolving through stories, dialogue. And creating this nature manifesto together, committing to sort of addressing social justice at the same time. That they also wanted to have some very practical knowledge to learn from each other, and from experts. So Brazilian Chewies wanted to know more about renewable technologies and how to bring them to their communities. We wanted to know more about sort of air quality, how it's linked to chronic disease, for example. It's vector-borne disease trajectories, which is relatively new to us in the UK. And that it had to have regional and contextual variation. It couldn't just be a sort of off the peg thing for everyone on the planet. That so what was really interesting was that we heard a little bit about the Loveland veg boxes from Jasmine, but somebody came up with horseback. So apparently there's a lot of horses in Cornwall, and one of the Chewies was saying, well, if we could learn how to ride a horse, then we could, that would be an alternative provision if all the transport breaks down, which I thought was really fantastic. And the Brazilian Chewies talking about there's a problem with illegal electricity tapping in favelas, which people can't afford to buy electricity, so they sort of illegally obtain that, and that is very dangerous and associated with a lot of disruption, and actually making themselves sort of self-sufficient through renewable energies might be a way forward. So there were all of these things that were emerging, a lot of detail. So I'm going to hand over quickly to Sophie to talk about the evaluation framework, which is basically a way that we wanted to link the work that the Chewies do and evidence that to link it directly to climate health. Sophie.
Yes, when we started talking about evaluation, it inevitably led into a conversation around having a good foundation to be able to start thinking about what we're doing. And we talked about this 4 S's, kind of these 4 things we need to have before we kind of start talking about other data that we can collect and how we can evidence what we're doing. And the first thing to mention is that on all of this for us is we had different scorings based on different areas that we were, and Brazilians had their own differences in between kind of this different points. And a lot of this scoring also helped us reflect on where our projects are and what we might need in order to be able to have a stronger foundation. The first test is about being salaried. So it's not possible to run this sort of a service with only volunteers. You need to have salaried workers that, first of all, this encourages the social justice of like, this is sort of care that needs to be valued and appreciated, and therefore it needs to be salaried. And also it gives people the financial foundation they need to be able to deliver the wonderful work that they do deliver. It also needs to be supervised and supported. So there's different levels and different dimensions that trees need to be able to operate. A lot of the times trees come from variety of different backgrounds, bringing in variety of different skills, but there needs to be a place where all of this comes together under supervision of a medically trained professional, because none of us are medically trained. So that touches on having clinical MDT meetings, also having mental health support, because a lot of the times we come across a lot of emotionally taxing stories that we hear and hold on to. So having some sort of a space to be able to offload this and get a bit of support around what we need to keep our staff from burning out, from being able to do this sustainably for a very long time, and also to have a little bit better kind of understanding of kind of what support our residents might need as well. So having a space to be able to talk about what we're already doing and where we could take it to a higher level to be able to deliver kind of more appropriate support. And for that, we need to be skilled. So we need to have a more standardized kind of package of what trainings and what skills all of the trees need to be able to deliver the service that we do. Of course, this would vary. For example, I don't think any of us need to learn horse riding in London that much, but maybe in different areas of UK or in other countries that might be way more relevant. But there are some things that we do all share. It's really helpful to have motivational interviewing as a training, health coaching, mental health first aid, having good understanding of safeguarding, and some really common physical health conditions like diabetes, lung health, cancer screenings, things like that, that we inevitably will come across a lot of. And we need to be supplied. So we need to be able to have the resources we need to actually physically be able to go out and visit families. This might mean things like having appropriate uniforms. We in London have quite a few trees who come from a Muslim background. So when we give them T-shirts to wear, they actually can't wear the T-shirts. They can't put them on top of their hijabs or their abayas. So thinking about getting people vests that they can put on top, making sure that they have waterproof bags and coats as well, because it rains so much in London and in Cornwall, that this is the kind of things that you need to have in order to be able to go and visit people, to then be able to deliver the interventions that we do. And in terms of then, if we have all of this foundation, then what are we tracking? And a big thing we talked about was the process measures and the outcome indicators, and how we wouldn't want this tracking of either of those two things to be burdening trees beyond their usual admin toll. So all the trees, when they go out and they do outreach or visits, are already logging all of that onto a system, and they already make notes in what kind of conversations they're having, what interventions are they offering, and what outcomes they're seeing in their residents. So rather than adding kind of more things onto their admin burden, it's seeing what is already there that actually also contributes to climate health. So a good example of this would be that a lot of us already record, if we talk to people about their healthy diets, about exercise, about reducing smoking, about having better access to green spaces. So all of those things automatically, on the backhand, we can consider as we're trying to help people have better planetary health awareness and also to lead healthier lives. And really nicely ties into kind of this concept of one health, that one cannot be kind of divorced from the other. And we're trying to now look into ways of making sure that we can also track the journey that the resident takes from having those initial conversations to having those interventions kind of implemented to the outcomes that they're actually seeing. So this could be things like, are we seeing a reduction in mold, food insecurity, water safety? Are we seeing an increase of our community centers and our community spaces becoming greener? People have better knowledge of how to access them and where to go. We are also seeing that people are better equipped to know kind of how to lower the costs of their energy, how to ride bicycles, things like that, kind of the more tangible things that we see in our community as an outcome of the interventions that we're delivering. And yeah, I think the best, I think I've covered everything, but if I'm missing something, can you feel feel free to come in.
Sophie, you have beautifully condensed that into 2 slides, which is amazing. Just hurrying us up a bit because I want there to be a bit of space for discussion. So I'm just going to touch on this really quickly. When we talked about this, what really stood out in this workshop was the joy. So we didn't talk about the doom and gloom of climate change. It was sea swimming, litter picking prizes, band of brothers passing down ancestral knowledge in Cornwall, positive experiences in nature shift attitudes more effectively than fear and information. And that the body first as the ecosystem. So I wanted to pick that one out because they said it's kind of like the curriculum shouldn't start with planetary health with this like lofty concept, but it should start with the body. So our lungs are influenced by the quality of air that we breathe. Our gut is influenced by the quality of the food that we eat. Our nervous system is influenced by the green space we have access to. So it should start from a body and link it directly to our environment. And that trust is the infrastructure and all of this, that we can't sort of load on lots of tasks onto the TUIs to be transactional. It's actually the relational and the community health workers as this advocate and agent in the community to rebuild the commons. And we talked about slow violence again in this conjunction, that you can't really do this work without also really foregrounding social justice, because there's this idea from Robert Nixon about slow violence, which is kind of polluted air, toxic food and poverty, which the TUIs navigate daily, and which is a form of slow violence. So this is, I wanted to stop here, and I get Sophie and Jasmine to wrap up without slides at the end, so I can show you what this curriculum looks like in practice. And what I'll do for that is I'll stop sharing this for now and share a mock-up of what this curriculum would look like. So I'm just asking.
That looks really great.
Yeah. So this is a mock-up in Claude.
Is it just me or is Connie frozen?
Yeah, I think Connie is frozen.
Sophie, Jazz, do you want to talk through this?
I would love to. Unfortunately, it's quite an interactive model, so it would be great if Connie could come back and kind of show us around how it works. But I can give you a little bit of an overview. Basically, we were talking about the fact that we didn't want a conventional learning curriculum where it's just like blocks of text, or like you just need to do e-learning or something like that. We wanted to be quite an interactive thing that people can fit into. So as we were talking about One Health, we thought about teaching planetary health through like a human body to kind of exemplify the fact that those two things are very much connected. So if you were to kind of click on the brain, you would find a lot of information about kind of the health that, oh, is Connie? No, Connie's completely gone. Yeah, I'll try to do it from my memory. So basically, if you were to click on different parts of the body, different related information would come up. So if you would click on the brain, you might see a bit of information around maybe like dementia, or there was also some information about mycelial networks, because those can be quite similar to how the brain acts. And then you can read a little bit more about mushrooms and how to cultivate them or how to eat them, and you can add your own articles in there. You can add your own case studies in there, so it kind of grows into a bigger way of learning, where you can not just learn from the curriculum that is put on there, but also from each other as we're adding on to it. Like if you were to click on the tummy area of the person, you would hear more about kind of the reproductive health and how to have sensitive conversation about family planning, but also about how to cultivate vegetables on your balcony. So it's all kind of intertwined with each other. And we're kind of trying to map that on a body where it feels appropriate. That's kind of the best way I can think of putting it. But just if you could add onto it, or if anyone would like to contribute.
So it's like a living, breathing model that's constantly being added to and
Yeah.
constantly changing as we go on. So I only just got to have a little peek at it before the meeting, so I feel like you summarized that really well.
Yeah, so I
Yeah.
had a little peek of it, working interactive version just before. And obviously the great thing about this, and one of the things we discussed at the workshop, is there are Chewies all over the world and they don't all speak English. So about if we have a visual curriculum and then use AI possibly to translate into the language that the person understands, then everyone can access it, and you click on the brain, which is pretty universal, and you go through into the content and you can click on the language that you wish to read it in. But yes, also crowdsource. We were very much thinking about, there's so many great examples from all of people all over the world, and if they're telling us about their case studies and what worked in their setting, that becomes a part of the curriculum. But hopefully Connie will rejoin us and we'll get to see
Yeah,
it.
he comes back.
I'm here. Was Team's telling me to stop talking. Sorry. I don't know how much of the curriculum I managed to share, if anything.
We just got a little peek of it in the top part of the body. So Sophie and Jasmine were
I'm
just
sorry.
telling us a little bit more about it.
So it was just it's just a mock-up, but the idea is that you have case studies that you can click on. It's all tagged and organized, and you can add your evidence. You can upload reports, podcasts, any evidence that you have, and that's multilingual and eventually like a really lovely resource for everyone.
Brilliant.
Yeah,
Should we move to questions now?
Yeah.
I'm just aware we've only got 15 minutes left, and I do want to give people a chance. Craig, do you have a question?
Hi, yeah, thanks for that. It's so interesting. And I love the sort of global aspect of it. So I was just wondering, I know, Rowan, you just mentioned that there's Chewies all over the world. Did you draw ideas or incorporate them while you were there from other countries, or what about in terms of exchange of knowledge with other countries and other Chewies? And are there plans to collaborate in terms of this?
Shall I take this, or Matt? While you're here.
Oh, I can. Well, thanks so much, Craig. I mean, I can just say a couple of things, but our foundational learning really has been from Brazil throughout, and we make that very explicit. But of course, community health workers exist and have been for many, many years and decades in Ethiopia and Nigeria and China, many places around the world. We've just always found that the Brazilian model is the one that actually most closely seems radically new and important for the system that we have in place in the NHS. But we also, interestingly, through this partnership, have facilitated international partnerships between Brazil and other countries as a result of our learning from them as well. So we've just established a partnership between Ethiopia, the Ethiopian Ministry of Health, and the Brazilian Ministry of Health, and they're setting up a visit to do exactly the same sort of learning. We've also facilitated partnerships between Brazil and Belgium. I know there was already pre-existing partnerships between Brazil and Angola and Mozambique because of the Lusophone connection. So really the model from Brazil has had far-reaching implications for many different health systems around the world. It's really exciting to play a small part in it. Wow, great.
We've got a delegation from Singapore joining us in September to sort of think about this model. We also had Cleo Baskin in Rio, who works for Field Crews, but is also a researcher for the Community Health Impact Coalition, and they operate globally. So their mission is to the pro-Chewy, so making community health workers professional and community infrastructures. So not sort of project based like they're sometimes used in the US, where you have a bit of money and then you get them to do something for that money and then it changes again, but really to use them in the way that the Brazilian model works. It's really the gold standard, I feel. Yeah.
Great, thank you.
Any other questions?
I had another question if people are waiting. And also I was interested because I know before you went, you were talking about how there was an MP going, and I wondered, what was there any sort of what was the perspective of the MP? Were there any kind of policy promises or follow-up made on his part? And I'd also be sort of curious what the Brazilians thought of him and how they kind of approached him to some extent.
Yeah, so we took Simon Ofer on the trip because he's a GP and he is also a parliamentarian, but he leads the all-parliamentary group on net zero in the NHS, but also workforce, I think, and beyond pills. So he's really interested in community approaches and social prescribing. He's been a great advocate for that. So he was kind of a friend, a critical friend, but he was really, really interested in this model, and I think he was quite moved. He did a little clip which I can share with how impressed he was with the proactive nature of the Brazilian model, and how we can really learn from that in the NHS instead of being sort of transactional and reactive, to really pivot to a street view and community-based primary care model. But Matt, do you want to say about like how did you feel being in Brazil, and what did the Brazilians think of him?
Well, I mean, it had a lot of currency bringing in MP, because what it meant was that our Brazilian colleagues, who value immensely our partnership and have done for many years, really rolled out the red carpet. So because, having a representative from the UK government there really changes things in terms of from a diplomatic perspective. So we had security, the police were involved, because, if something was to happen to him on their watch, that could be a national scandal, etc. So they brought out the British flags. We had to take photos. We met with the vice president of the Fiocruz institution. It was all a very, very sort of special moment. And that in itself has currency, right? It's sort of, we're writing a book at the moment on scaling and sustaining healthcare innovation. The CHUI model is the case study that runs throughout that. And one of the things we talk about in that book is having key strategic players or actors lending their legitimacy to this particular effort, because it's at key moments that raises its visibility. They can speak in corridors of power and mention it to other people, and before you know it, West Streeting is cited on record as saying, but this is what we should be doing. And it's through these little navigated, sort of dynamics of leveraging power and people that become really, really quite important. For him on a personal level, I think, as Connie said, it was transformative. Visiting Brazil, I think he got a lot out of it, and is really understands and got it straight away that this proactive relational approach that's universal, geographically delineated, really will epitomizes our ambition for left shift and neighborhood health and social care in the UK. And he got it straight away. So sometimes things don't just jump off the page. You really need to. We've noticed that taking them to Brazil actually has a real emotional and intellectual consequence, by actually seeing it in action, and can be really transformative for a lot of people.
Thank you.
I have one question. You mentioned the participatory approach, Connie, and how challenging that was for you. Have you got any comments there? We've got a number of people on the call, some from clinical backgrounds, some from academic backgrounds. Would you recommend such participatory approaches to people?
Definitely. I think I'm not one to I had to kind of sit with the uncertainty and kind of just trust the process, but it was really humbling to see that they didn't need me at all. It was just lovely to see how this kind of process just emerged, and how people kept a track. I think, Rowan, I have to say your facilitation obviously made all the difference. So Rowan was the mastermind behind all this.
I didn't ask that question to get there, honestly.
No, but I just wanted to say it because it is, of course, not all us getting together in a coffee chat. It was meticulously planned by you and Alex, and sort of just setting people on the right track. But then once that happened, it was really amazing how smooth it was, and how much really, really fantastic stuff came out that I would have never thought of by myself. So I just I'm really quite blown away by the process, and we want to do more of that. So we've got Renee Lovenstein from Task coming to have a meeting with us. She is an international expert in participatory action research. And really, our CHUIs had a taster from Andrea Cornwall from King's College London in participatory research methods, and we had an IHR training on research championing, and I think this is the way to mobilize knowledge, get people interested in research, and really get TUIs to be the sort of main contributors to this work. So I really love it.
Any other questions? Sophie, go ahead.
Not a question, but just a comment. I think it's amazing work, and I've seen it sort of evolve with my work through HCL and the Octopus meetings, and now to work closer with you, Connie, is just amazing. And I think recently I've been in meetings with other knowledge mobilization fellows, and we're having conversations around what is knowledge and whose knowledge is it. And I think it's just really lovely to see within your slides and presentations today around the fact that actually the idea that the community already hold, the knowledge of what's needed to transform their reality. And I think it's just so refreshing to see, because actually more people should be working in this way within the NHS and given, to do proper co-production and work with communities, because so often it's not done that way. And, surveys and checklists go into communities, and then we come away and get a publication and the community don't benefit. So it's just lovely to see. So yeah, thank you for a really great presentation.
Thank you, Sophie. And I think I've definitely had a real education in the last 5 years of working with the TUIs. I've kind of really changed my mind on so many things, and it's quite interesting to see. I mean, Sophie, you could probably back me up here. When we started off in the beginning, I was very much leading the MDT. The TUIs would come to me with questions about clinical questions and how to do something, and I would give advice. And then the dynamics have changed now, so I often ask the TUIs what to do with patients of mine, because they're such a fountain of knowledge. And of course that's also what I love so much about the community health and wellbeing worker model, that it empowers the TUIs as well. So it's really lovely to see the transformation that the TUIs sort of go through, realizing that they actually have a lot of knowledge, and the trust that they have in the community, and how they can help people. And Sophie, do you want to come in on that?
Yeah, I do actually. I think there's two things that have been on my mind since we started having this conversation. The first is kind of, I think there's a lot of reward in involving the communities in the research, not just for the researcher, but also for the community themselves, for research to stop being kind of this abstract thing that happens in the background in kind of academic circles that they can't access, to something happening on their doorstep, to something that they can contribute to, can't have control over, and like see what comes out of it. It also makes them more interested in research and makes them want to read more about it, find out what goes on in that sphere, which I think is a great opportunity to educate people, but also to be educated by them, because I think a lot of the times people from academia might not have the same experiences as people from the communities that they study. So it's a very, very beautiful way of doing research. And another thing I wanted to touch on about is, by having people from the community involved in these sorts of things, it spreads far beyond just the reach of the project. I was talking to one of my TUIs, Amal, she's a Muslim woman who she's from South Sudan, so she's involved in a lot of community groups for South Sudanese women. And in our area, she's a TUI. She does wonderful work around kind of health prevention, and she's particularly passionate about breast cancer. And she has done the NIHR training. She has done, and she's quite curious about these sorts of things. And recently I was talking to her in a one-to-one. She shared with me, which I'm sure she wouldn't mind me saying to other people, that in the local community group that she has access to, anytime she does a training with us, she goes there and redelivers that training to her local community outside of the project. So this kind of work spreads far beyond what we can even see. I didn't even know she was doing those things. It only recently came up because she got nominated to be as one of the lead speakers, because she does it so often, which is really lovely to hear, that the knowledge we are giving to our trees within this project it goes so much more beyond. And who knows how many people in that community group start becoming interested in this sorts of things. So yeah, I just wanted to share that.
we've just got a
Thank
few
you,
minutes left.
Sophie.
Any last thoughts from Jasmine? Or any last questions? Go on, Jasmine, then I'll go to Dion.
Okay. Yeah, it's just an amazing project to be a part of, and the team is incredible. I miss everyone very much. It was amazing to come together for a week, and everyone was just so kind, and yeah, what we made together felt really special.
It was really good. Dion, did you have a question?
Yeah, just a really quick one. I think, yeah, it's really amazing work, and I think it's really interesting. Again, talking about how it, just what you just said, Sophie, about how it spreads. So my question is just about kind of how you recruit people, because I'm just interested to see like how, people come along and how they are. I mean, obviously people develop in the role, but it's also a very unique role to have within the community. So I just wondered how you kind of pick people, for lack of a better way of asking.
Yeah.
Dion, that's such a good question, and I think we learn so much about from the Chewies that we can actually apply to other areas as well. And what's really important is that they're not chosen on qualifications; they're chosen on character, not characteristics. So we're looking for people that are the right people. They're team players, good listeners, good communicators, eager to learn, passionate about their community. And then you can kind of learn anything on top of that. And I think when we recruit to sort of people where we look for technical skills like GPs, etc., we tend to not really prioritize those qualities in a person, but actually, when you meet the Chewy teams and the one in Dukashiyas as well, you can tell that they're just wonderful people who really want to make things good for the community and empower themselves, and that's just really lovely. So I would say we should probably have that across the board. We should pay more attention to our values and who we want on our teams.
Yeah, Sophie.
Yeah, just a small thing to add. I think one thing that was quite common in my team when we were recruiting, that a lot of the people that we were recruiting had a long history of volunteering with their local community anyway. So they already understood kind of the values that we would be promoting, because they were the same values that they shared. And also by being able to hire people based on characteristics, based on character rather than characteristics and qualifications, also meant that we have in our team, we have someone who has a degree in nutrition, someone who has a degree in law, someone who has been trained as a doctor, and someone who hasn't worked in past like 10 to 20 years.
Or
so you get a very
worked.
big, or never worked,
Yeah.
but has done a lot of has had a lot of caring responsibility in their life. So that in itself was a unique kind of learning experience. So yeah, I'd say having quite a candid conversation about what the role is going to be like and how it will affect kind of their life as well, because they become quite a known member of their community, already makes a lot of people say, that's not something I can do, for example. And it attracts only a certain crowd in our experience.
So true. Yeah. Very
we're
special
just
people.
We're just hitting the 2 o'clock now, so thank you so much for joining us. As I say, we have a microsite and the video will be on there if you want to go and have a look at the slides or the video again. And if you want to get in touch with people, we can put you in touch with any of the speakers. Thanks so much for joining us. Thank you everyone.
for
It's
having
lovely
us.
to see colleagues.
Thank
Darren,
you.
Nick, it's great to see you. Natasha, Dion. It's so good to see people.
Thanks,
Thank you so
everybody.
much, Connie.
Thank you,
Thank you,
everyone.
Sophie and Jasmine.
Bye.
Thanks a lot. Bye.
Thanks. Bye.
Are you happy with that, Connie?
Oh, it was lovely. Yes. You're still
Yeah.
recording.
Oh, yes. Because if Sophie's gone, surely the recording has stopped.
Oh yeah. No. Seems to still go on. Oh, this was lovely.